Hello, and welcome to this Nerdcast Concepts and Thresholds. This is part three, the role of lactate threshold number one in training. So, in the last lesson, we talked a lot about the concept of lactate threshold number two, or FTP as we commonly refer to it. And I demonstrated why your FTP, your LT2, is such an important transition point that it allows us to anchor both the physiological impacts, the three physiological zones we're seeing in the background, green, yellow, and red, and the more specific performance training zones that allow us to have more specificity in performance. I pointed out how this lactate threshold number two, or FTP, has clear transitions, very clear transitions. They're easy to see physiologically. They're actually reasonably easy to measure. And we have significant impacts by that lactate threshold number two on the time intensity relationship of the work we can do. This last one is very important. Below lactate threshold number two, or FTP, we have a long-term ability to go with those power rates. Once we go above threshold, fatigue comes on very quickly. We have a limited amount of time we can train above those thresholds. But what about lactate threshold number one? What role, if any, does that play in our training, and what does it signify? Well, it obviously happens, if you're looking at our chart here, at a much lower intensity range. And we call lactate threshold number one, LT1, because we can measure it in a slight uptick in the accumulation of lactate, but it also is very typically referred to as your aerobic threshold. So, as always with these things, naming plays a real challenge. We should have had a universal conference 100 years ago and said, we're only going to use one name for everything. So, you need to understand that lactate threshold one and your aerobic threshold are basically the same thing. So, when we understand why track it, why train it, what are we doing with it? LT1, or your aerobic threshold, significantly impacts an athlete's ability to sustain higher intensities. That doesn't mean high intensity, but holding, like, think about how long you can hold good zone 2 intensity. So it impacts an athlete's ability to sustain higher intensities for longer durations, improve performance, and enhance overall endurance and efficiency. So basically, it is a measurement of your aerobic engine and what you can do aerobically. When we look at how we can test these in testing, this is a blood lactate test. I demonstrated one of these in the introduction. And we can see, and this is very typical, here we have intensity going up, and here we have blood lactate going up. As the athlete starts to move up the intensity ramp, lactate usually drops a little bit at first. That's just very common. Then in this example, because it's an example, we see a nice clean uptick, and it kind of keeps sort of upticking to here. Then we see this more rapid uptick. So what that really means is, when we think about what are we looking at, lactate threshold one, or aerobic threshold, is the highest exercise intensity at which the body can maintain aerobic metabolism. And that's happening right about here. In this case, we're looking at 2 millimoles of lactate per liter of blood. So that's a common marker, but we can see that it is beginning to uptick right here. That's pretty clear in this test. The challenge of really measuring and finding out this marker of aerobic metabolism, most lactate tests will look more like this. This is the one I used in the introduction, where you can see where LT2 happens. You can see kind of right in here, it starts to tick up with these arrows showing. LT1 is actually kind of happening here, or is it here? It's muddy, like it's kind of murky in that area. You're not really sure exactly where or how that is happening. So to make it easier in testing, labs and physiologists have tried to kind of make a more definitive approach instead of just looking for a slight uptick. So typically it's measured at the point in which an incremental exercise test, a ramp test of power, where there's more than a 1 millimole per liter rise in lactate above base levels. And this usually comes around 2 millimoles. So why is it 2 millimoles? It's it's a bell curve. The reality is, for most of us, we will fit into this LT1 bell curve, but not all of us. I've had plenty of athletes who produce more lactate, but tolerate it better. And I've had athletes who produce way lower, so it gets harder to track. But this is the typically accepted definition of or marker, the way they test and look for LT number 1. So you can see it's not unlike LT number 2 or FTP, there's no hugely clear transition. You saw that in the LT2 FTP slide. You can also see it's kind of challenging. It's actually extremely challenging to measure this LT1. So we do understand that tracking it has a reason. It gives us insight into that aerobic fitness and capacity. It also has some other impacts. So is there a way we can track it? Well, one of the things that does happen, and it's related to this lactate, but it's maybe more noticeable by you, the athlete, is you have a change in your ventilation rate stability. Up to you get to this point of LT1, your ventilation, how fast you're breathing, your respiratory rate, right? You're breathing pretty much in like a nice linear uptick. Go a little harder, you're just breathing a little bit harder, but you don't really notice it. You're well in control of that respiration rate. Your Gear 1 breathing in our system probably reasonably casually. As you start to go beyond LT1, you get to this break point and go up. It's not as linear. You will notice a subtle but noticeable uptick in respiratory rate and ventilation need. And what's happening is you've now left your sustainable aerobic metabolism. You're starting to make energy anaerobically. That means we're burning carbs. That means we're using some fast twitch muscle. That means we're producing byproducts. We've talked a lot about lactate in this measurement, but CO2 is another byproduct, as we know. So you have that uptick in ventilation rate because now you're producing more CO2 and your body's trying to expel that. It's trying to get rid of it. So this is a noticeable uptick if you learn how to pay attention. So I'm going to give you a non-fancy way to test this that, it's actually been studied. There's 2 or 3 good studies on it that it actually does work, and it's as accurate as an LT test in a lab. Now, 2 or 3 studies isn't enough to say, yes, absolutely, but it's got promise. And this is what's known as the ABC test. See, we have this knowledge that the ventilatory rate, or the respiratory rate, going up when we get above LT1, you could probably say about 26 words out loud before you need to take a breath. 26 to 30 is what it really comes down to in the studies. And that just happens to align with the alphabet. So here's a great test. And I'll kind of demo it in this little, I know I'm in a little window here, but I'll do what I can. You take a good deep, you're riding along, get warmed up, get at least 10, 12 minutes into your workout, your steady aerobic endurance. Take a deep breath, deep inhale, and then say the ABCs. But you need to enunciate each letter. Remember, it's 26 words. A, B, C, D, E, F, G. So you've got to be able to say each one. No cheating like I did when I was in like kindergarten. The teacher would be like, we're going to say ABCs, and you go, A, B, C, D, E, F, G, H, I, J. You can't do that. A, B, C. If you can recite the entire alphabet and maybe a couple more, remember it's 26 to 30 words. So maybe you go right back around, you get to Z and then A, B, C, D before you need to inhale. And I don't mean pass out on the bike, but you're like, man, I really need to inhale. If you can do that, you are typically below LT1. And are probably doing your zone 2 and endurance work in a pretty good pace. If you can get to D the second time around, you're in a pretty good zone 2. And why this is such a great, simple test is if LT1, we have LT2 and LT1. I've introduced these now in the last two sets as they're two factors. They don't move left and right in your fitness together. When we foundation phase, when we're doing a lot of base training like we're doing now, LT1 can actually move more at a greater level or at a lesser level, but typically it's at a greater level, meaning it can improve more than LT2 will in base training. So if you really want to fine tune your zone 2 training, what's a good endurance target? Getting back around the alphabet to, A, B, C, D. So you do the full alphabet and back around to D. That's a pretty good tell because that tells you you're a little bit under LT1, which is exactly where you want to do your endurance training. That completes this Nerdcast course. Hopefully that last little tip helped. Talk to you soon.